But then I treated you as well,
Yes.
right? Because you have to treat X number of patients and get X number of adjustments under our belt. And you were my first cancer, I don't know, survivor. You were my first patient I'd ever treated that had cancer in the past. So I remember I was freaked out.
You're like, wait, what?
I thought you're this tiny little thing. You have this history of cancer. And when you're in school, you don't have the confidence and knowledge of who can handle chiropractic
Medical
care,
history,
who can't, when is it a contraindication, when is it appropriate. So I'm thinking, oh my, I'm going to break her. And I was very uneasy getting into it.